GLP-1 medications can be life-changing for weight loss and blood sugar control, but mixing them with the wrong foods and habits can trigger side effects you don't want. In today's video, I'll break down 15 things you should not do while on a GLP-1 medication, what side effects they can cause, and how to avoid side effects while getting the best results on the GLP-1 medications. Stick around as you don't want to miss number 11, which happens to be the most overlooked frequently. Hi, I'm Dr. Bazgha Khalid. I'm a board certified internal medicine and obesity medicine doctor, and I prescribe GLP-1 medications all the time. And I have helped hundreds of patients improve their metabolic health and lose weight while using GLP-1 medications. And this channel is informational only and should not replace your doctor's medical advice. Let's do a quick refresher. What are GLP-1 and GLP-1 GIP medications? Semaglutide is GLP-1, which is short form for glucagon-like peptide 1 receptor agonist medications. They come as brand names Ozempic for type 2 diabetes and Wegovy for weight loss. While tirzepatide is the GLP-1 and GIP, which is the short form for glucose-dependent insulinotropic peptide receptor agonist. So it's a dual receptor agonist with brand name Mounjaro for type 2 diabetes and Zepbound for weight loss. These GLP-1 and GLP-1 GIP medications mimic gut hormones, resulting in slow stomach emptying, reducing appetite, and improving blood sugar. GLP-1 benefits are shown in several trials, STEP trials for semaglutide and SURPASS trials for tirzepatide. These trials show significant weight loss and improved blood sugar control on these medications. So if you are on a GLP-1 or GLP-1 GIP medication, then what are 15 things you should not mix with GLP-1 medications? Number one is sugary, greasy, or fried foods. So here's why. GLP-1 medications already slow digestion. Heavy fried, fatty, and sugary food can cause bloating, reflux, or even severe nausea, making it hard for you to tolerate GLP-1 medications. Also watch labels for sugar substitutes and sugar alcohols like sorbitol, xylitol, which are common in some low carbohydrate snacks and can cause stomach upset and side effects. So it's best to opt for lean protein, high fiber carbohydrates, and healthy fats in smaller portions while on GLP-1 medications. Number two is heavy alcohol intake. Heavy alcohol intake increases the possibility of nausea, vomiting, and risk for low blood sugar, especially if you are on other diabetic medications as well. It is best to avoid alcohol, and if you do drink, do so moderately and with food and hydrate really well. Number three is carbonated beverages, especially sodas or sparkling water. These can cause extra bloating or discomfort, while GLP medications already slow stomach emptying, and this can be very problematic. So best is to opt for water, and remember, staying hydrated is essential on GLP-1 medications. Number four is very high fiber diet introduced suddenly. This can be problematic as we all talk about how good the fiber is for providing satiety, for gut health, and for weight loss. But going from a very low fiber diet to a very high fiber diet overnight can actually cause bloating and excessive gas. So it is really important to increase fiber in your diet gradually while on GLP-1 medications to get the best benefit of fiber without the side effects. Number five is energy drinks or excessive caffeine. Now, these may irritate the stomach or may even cause jitteriness or increase the risk for dehydration. So the best is to stick with water to stay very well hydrated while on GLP-1 medications. Number six is lying down immediately after eating. This may increase chances for acid reflux and risk for nausea. So best to wait at least 1 to 2 hours after a meal before lying down. I think it's best to have last meal of the day 3 to 4 hours before your bedtime to allow enough time for your body to digest food and decrease side effects like acid reflux. Number 7 is inconsistent dosing schedule or stopping your GLP-1 medications abruptly. Now, taking these injections on wildly different days or times can reduce effectiveness of GLP-1 medications and increase risk for side effects. So it's best to stick with the prescribed weekly schedules. Also, stopping your GLP-1 medications abruptly without guidance may cause rebound hunger and appetite or uncontrolled blood sugar. Therefore, it is always best to taper GLP-1 medications under the medical guidance and supervision of your doctor. Number 8 is skipping meals entirely. This can lead to hypoglycemia or low blood sugar, especially if you're diabetic and are taking other diabetic medications that may also cause low blood sugar. So, skipping meals may also cause fatigue, promote overeating later. So, best to eat small, balanced meals or protein snacks in between. Number 9 is rapid dose escalation, like jumping, let's say, from Wegovy of zero point 0.5 milligrams straight to 2.4 milligram without utilizing the in-between doses, increases the risk for stomach upset and other significant gastrointestinal side effects. Therefore, it's best to follow the recommended titration schedule, and I have a detailed video on GLP-1 dose titration that you can find in my GLP-1 playlist. Number 10 is dehydration. Adequate hydration is non negotiable when you are on a GLP-1 medication. Let's say if you're having some side effects with GLP-1 medications like nausea or maybe even vomiting. Now combine that with less fluid intake, and this adds fuel to the fire and may lead to dehydration, fatigue, dizziness, and just an overall added stress on your body. Aim for at least 2 to 3 liters of water daily, more, of course, in hot weather or with exercise. Number 11 is certain oral medications without timing adjustment. Since GLP-1 medications slow stomach emptying, this may delay or reduce absorption of other medications and make them less effective. As an example, your oral birth control may not be very reliable when you start a GLP-1 medication or anytime there is dose up titration on your GLP-1 medication. So, FDA labeling advises using a non-oral or barrier method for contraception for 4 weeks after starting or increasing the dose of GLP-1 medication, especially if you are on Zepbound or Mounjaro. I suggest to my female patients in childbearing age to consider a non oral contraceptive method with their gynecologist consultation, since oral contraceptives are just not reliable on GLP-1 medications. Efficacy of your other oral medications like thyroid medicine or antibiotics may be affected as well due to GLP-1 injections, and it is best to discuss timing of these medications with your doctor or pharmacist. Number 12 is skipping follow-up appointments. Side effects or silent issues like mild dehydration, gallstones may go unnoticed. It's best to stick with your doctor's follow-up schedule recommendations while on GLP-1 medications so that your doctor may pick up a minor issue before it becomes a problem. Number 13 is ignoring severe side effects. Symptoms like persistent abdominal pain, vomiting, severe constipation, vision changes, or severe nausea or other serious symptoms need urgent evaluation. See your doctor urgently if you have any concerns and don't try to tough it out. Number 14 is crash dieting or over restricting calories. This can backfire and can cause malnutrition, muscle loss, fatigue, rebound weight gain. Therefore, it's best to focus on protein, fiber, and resistance training for sustainable weight loss. Number 15 is sleep neglect and high stress. Poor sleep and chronic stress increases cortisol, hunger hormones, and may blunt GLP-1 benefits. Therefore, prioritize your sleep. Goal is 8 hours of quality, uninterrupted sleep, and consider meditation and other stress reducing techniques. Let's recap. Do's and don'ts on GLP-1 medication. Do's on GLP-1 GIP medications are eat balanced, smaller meals, hydrate consistently, follow titration instructions, get regular labs and eye exams, introduce new foods slowly, and track your body's response. Keep a symptom journal to identify triggers, hydrate consistently, especially if experiencing gastrointestinal side effects. Maintain regular follow ups with your doctor. And the don'ts on GLP-1 GIP medications are: don't rush your dose, or drink alcohol heavily, or skip meals, or ignore side effects, or skip follow up appointments, or combine medications without medical advice. GLP-1 GIP medications like Ozempic and Mounjaro are amazing tools, but only if we use them wisely. By avoiding these 15 pitfalls, you'll minimize chances of side effects while maximizing your results and protecting your long-term health. Remember, the medication is a tool, but your daily habits make the magic happen. If you found this video helpful, hit like, subscribe, and share with someone on their GLP-1 journey. Bye for now.